Hi YouTubers and YouTubies, it's Michelle. I have been super busy, so I've not been able to, hello Daniel, I've not been able to videotape my pre-op orientation that I was going to do for you. Can I help?
That's weird.
Can I help you?
We thought we cared, but we didn't.
A lot of people do care. I don't know if you could hear him what he just said. Why don't you say it over here on camera? He won't do it because he's shy. Hard to believe coming from a mom like me, I got a shy kid. Anyway, because I'm not scared of nothing. Alrighty, here we go. I was supposed to do a video on the pre-op orientation, and a lot of what the pre-op orientation was a previous video where I talk about your meal plans, how much protein you're supposed to have, your supplements and all that. But they did go over some, briefly, they went over some things for troubleshooting if you're having any problems. They also went into what happens while you're in the hospital. I'm going to try to get all this in. What kind of diet you're on while you're in the hospital, or should be on while you're in the hospital. And it makes a difference because I've watched some videos where people have had this surgery and the people who were tending to them, the nurses, had no clue what to give them. So you're going to have to know so that you know what to tell people that you've got to have after your surgery, and it doesn't matter what surgery it is. Lap band is sometimes outpatient, so you'll go home and just deal with that yourself. But anything that requires a surgery, where a 1 night, 2 night, 3 night stay is, you're going to have to make sure they know what you're doing if they're not a bariatric facility like I'm going to on Monday. We also talked about the diet after surgery. I'll try to get into that, and of meal samples of that. So here's what you want to know for anything that's troubleshooting. If you're experiencing nausea, you're supposed to try to do everything by yourself before you call anybody for, you know, whatever. But for nausea, you're supposed to first try eating a different food than possibly what you had that made you nauseous. Eat slower. That's a big thing. You've got to change the habit of shoveling it in if that's what you're used to, or taking larger bites. You've got to concentrate on what you're doing, because this is going to make you sick if you don't. And you don't want to be sick. It's only going to take a couple times of being sick, and then you figured out not to do that anymore. If you're nauseous, you want to try to eat your foods at room temperature if they're too hot or too cold. That affects a stomach that has had surgery. Okay, now if you've done all of that and that does not work and you have to call the doctor, you only do it if it's persisted more than 48 hours. Call the office and talk to them and see a physician and or a dietitian if you can make it that long. I'm not kidding. Some people have problems, okay? If you're vomiting, take smaller bites of food. Chew it thoroughly. You got to chew it so that it has the consistency of a liquid. That's going to be really hard for me because I kind of am that shoveler. But that helps with chopsticks, because you have to, when you're eating with chopsticks, you have to kind of watch what you're eating, so you only get little bites like that on a chopstick anyway. Eat slower again. That's a big thing. You've got to learn how not to inhale, is the frequent word, the food, which I think some of us do. I know I do. Smaller, more frequent meals. So you want to have only what you're supposed to have. The proper allotment for any of these surgeries is half of the meal, and we're not talking a plate. We're talking that's about the biggest you're going to get, which is the size of a cup. Okay, I don't have anything here to show you. Everything's too big. But like a coffee cup, I guess this would be good. A coffee cup bottom is a little, this one here is a big coffee cup, but a standard coffee cup would have the right size bottom, I think. But this circle right here, this one with the detail on it, is about the size. So half of that would be protein, half of that would be vegetables, or something healthy that has some minerals in it. Remember, you can sprinkle your protein powder on top of stuff too, especially if it's unflavored. Chew thoroughly, so you're going to have to remember to do that. Eat slower, smaller, more frequent meals. So you're going to have little meals. Half of it's going to be a protein, half of it's something else. Preferably not a carb or starch. Practice good food sanitation. Wash your food. That would help you if you're going to be vomiting. Sip on clear liquids. Do not drink 30 minutes. Do not drink while you're eating. Drink 30 minutes before and 30 minutes after. Do not do it while you're eating because you're going to expand your stomach with fluid, not be able to put enough protein in. And that's key. Do not eat dry food, so everything can't be dry. You can't eat no popcorn no more. If you have problems that are still persisting and you're still vomiting, I'm not going to get through with all of this. That was 5 minutes, and I've not even finished the page. If you're still vomiting, if it persists more than 24 hours, call the office, see the physician and or dietitian. If you're experiencing diarrhea, which is part of dumping, in my opinion, dumping is having cramps, sometimes diarrhea. It all depends. You get cold sweats, you feel hot, cold, uncomfortable, nauseous a lot of the time. I have diarrhea. I haven't had surgery, but I experienced dumping already, and I get diarrhea. With the cramping, with the cold sweats, the whole nine. Eat enough fiber. Use fiber supplements like Benefiber. Stay hydrated. Really, really important to keep the fluids in your body. You've got to drink all day long. Fluids. Clear, good fluids. Avoid watery foods like watermelon, lettuce, etc. Well, there goes my salads. I guess I'll have to do it with just spinach. And I like watermelon too. This is, of course, if you have diarrhea. I don't know what's going to happen with me, and I really like watermelon. If it lasts more than 3 days, call the office. Constipation. Can't go do your number 2s. Can't get the poopies out. Then you're constipated. But you got to remember, when you think you're constipated, you're not taking in as much food too. So constipation has a sensation of needing to go and not being able to go. Not the same as just not going. That's not having any food in your system, so you wouldn't be able to go. There's nothing there. So constipation is having the desire to go, but not being able to go. Increase your fluid intake, so you're going to want to have more fluids in your body. That is oftentimes the reason why people are constipated. There's not enough fluids to flush the system, as they would say. Increase your walking. That helps your bowel movements get generated and going, so you want to do a lot of walking. Increase your fiber. Of course, fiber is a roughage, and it goes through, and it helps to shovel it all down to where it needs to go. And use a supplement if necessary for your fiber. If it lasts more than 3 days, call the office. Lethargy. Now that's lethargic. That's feeling, males in, feeling worn down, tired, draggy, exhausted, sleepy. Which when you've lost all this weight and you're doing all this, you should not feel so much, because now you don't have this extra weight around. It's not absorbing all of the nutrients in the fat anymore. You're actually losing fat, so your lethargy should go away. It should. That's what everybody else is telling me. I've lost weight before, like 60 pounds, and didn't have an increase in any energy. So, I don't know. I might still have lethargy. But if you do have that, increase your exercise so that you are burning whatever's in your body. Take an iron pill daily. Increase your protein intake and drink enough fluids again. If you still feel lethargic, which I may, you'll have to see a physician for your possible nutrition lab studies. So they're going to check everything, your protein levels, your iron levels, your calcium levels. All those levels have to be really good, because you don't want to be malnourished and having malabsorption issues. Because if you're not getting enough vitamins and minerals, then you're going to be tired. If you have trouble swallowing, sip on some warm liquids. Go back to clear liquid diet for 24 hours. It never hurts to go back, but you never want to go forward if you've not gone through all the post-op stages yet. So you can always revert back to simple things like pureed foods and clear liquids and a liquid diet, but you cannot, if you're still early post-op, go ahead of where you should be. So just remember that. If all that doesn't work, if that persists, that you cannot swallow for more than 24 hours, call the office and see a physician or a dietitian. Good, I got through that page. If you have thinning hair, that's a lot of the thing that I hear on the videos. Everybody loses their hair about 3 months out, and possibly for a period of time. Some people have loss of hair for an extended period of time. So listen carefully for thinning hair, what you can do to help that. Increase your protein intake. What have I said before? Doctor says you have a 45-gram protein intake. A lot of people are not matching the protein intake. They're lowering it. You cannot lower the protein. You can go above it. You can go another 45 if you can get it in. Get 100. There's nothing wrong with getting more protein. That's what you need. It's getting less protein that matters. So do not do less. Do the expected amount. I'd do more. Okay, mine's 95. I'm going to try for 100 or more all the time. Make sure you are including iron, omega-3s, and a B complex. See, all that helps your hair loss. Helps your nails too. See, that was Messenger. Yahoo. If that doesn't work, you may need additional supplements as appropriate, and you need to call your dietitian. Okay, if you have blood and vomit or in your stool, you're going to have to call the office immediately, because that means something's wrong inside your stomach. You shouldn't have any of that. If you have a fever, you might want to call the office. I would call the office, because you don't know if it's a flu or if it's an infection. And if it's an infection in your belly, it could go even further, so you don't want that to happen. Gas is super common, I hear, from all the videos. So, this is what they tell you to do for gas. Use a gas-relieving medication. We all know what those are. If you can swallow it, that's great. If you can, if it's a pill, you could chew it. If it's a deteriorating pill in water, take it that way. If it's a liquid, drink it down. Avoid foods that cause gas, like cabbage and broccoli. Broccoli is the worst for me. I don't even touch it because it gives me gas. I can imagine what it's going to do after surgery. I'm not touching broccoli. I like cabbage, though, so I might have to consider not eating cabbage anymore, and I really like that. If it lasts for more than it needs to, and you cannot get rid of it, begin a lactose-free diet. So you're going to want to take the milk out just to see, and see if that's not the problem. You might be lactose intolerant. Productive burping, or a PB, is what they call it. If it's an issue, take deep breaths, and eat slowly. Do not overeat. Chew your foods to a liquid texture. If it lasts longer than you should, call the office, see your doctor or physician. Reflux seems to be common among people who usually have had some reflux. I've not, so we'll see if I have that. Wait at least 3 hours after eating before laying down. Now, you could be miserably ill by then, couldn't you? 3 hours. I mean, you got that acid reflux and want it to come up and it just burns. I can see waiting 3 hours being a torture test. Avoid high-fat meals. You're not supposed to be having a lot of fat anyway, so that shouldn't be a problem. Just cut the fats out. Avoid overeating. Again, you're going to have that stuck feeling. That can lead to that reflux sensation that goes on in there, and you're having problems. If it lasts for a while, call your office, see your physician and or your dietitian. That's what you're supposed to do for those things. I'm going to cut this one off right now. I have several other pages that I'm going to show you several other things on. I am going to make them different ones. But for that right now, I've got all that. And I'll put annotations up as you see them for whatever it is that you got to do. So if you have to go back to this. This is simply troubleshooting any problems that go on with your surgery, and it's pretty much across the board, depending on sleeve, lap band, gastric bypass, application. It's going to be pretty much the same. So thanks again for everybody who's been watching, who's been subscribing, commenting. Keep them coming. I'll have another video right behind this one, so thank you. Have a great day. Bye.